You have done 2 classes already on the urine, normal constituents, and last on the reducing sugar and Benedict test. So today we are going to study the part of the abnormal constituent of urine, which is protein. So in introduction, the glomeruli of kidneys are not permeable to the substances with the molecular weight of the 70 kilodalton. Hence, the plasma proteins of molecular weight more than 70 kilodalton are absent in urine. In normal urine, the traces of protein may be found. The amount is so less that it escapes the detection of by any of the simple test. Okay, understood? So, in a normal sample of the healthy person, the urine content of the protein in the urine is very less, that it less than 250 milligram per day, and in normal urine the protein cannot pass the glomeruli. So because the size is very less, 70 kilodalton, but in the affected sample of urine, the glomeruli not work like this, and the glomeruli it's failed to filter the size of the 70 kilodalton. So in renal disease or in other diseases affecting renal functions, excretion of proteins in urine is excreted either as a result of the changes in the glomeruli or allowing increases passage of proteins, like in glomerular proteinuria, or if impaired reabsorption of the protein into tubule, like tubular proteinuria. An abnormally high concentration of protein in urine is associated with lesions of the bladder, prostate and urethra. And here are the tests for the proteins. So protein can be detected in the urine by any of the following tests, and all these methods are based on precipitation of protein. Heat coagulation test, which we are today we are going to do in our lab. This is the main test for the detection of the protein, and also we can do the sulfosalicylic acid test too, and the rest 3 for you, only for your theoretical knowledge, can be asked on your viva. Then third is the Heller's test, Heller's nitric acid test, and the precipitation of protein by alcohol and acetone, and the fifth one is salting out. So heat coagulation test. The principle of the heat coagulation test is when a protein is heated, its physical, chemical and biological properties are changed due to breaking up of the certain bonds like hydrogen ion bonds and the van der Waals bonds, and the resultant change in the conformation of its molecule. This process is known as denaturation. However, when the coagulable proteins are heated at their isoelectric pH, anyone know what is isoelectric pH? The test is based on the principle of the acid-base indicators such as the tetrabromophenol blue. Can you name other acid-base indicator name? This is the pepper, the name of the indicator. Like methyl blue, lemon is the indicator. So many indicators are there. Go and just study those names. When the dye is buffered at pH 3, it is yellow. The protein changes this color to green to blue depending upon its concentration. So at the lowest pH, the color will be yellow, and the pH, while the pH is lowest to highest, the color will change to green to blue depending upon its concentration. Comparison of developed color with color chart helps in grading that concentration of protein from the traces to the severity of +4. So the value can be 1 to 10 to more than 500 milligram per deciliter. 7th is the sulfosalicylic acid test. So the procedure to 3 ml of urine in a test tube, add few drops of 20% sulfosalicylic acid, and the principle is albumin is denatured by the sulfosalicylic acid due to coagulation, and the observation we will found a white precipitate appearance will be seen, and the inference this protein is present in urine. This test cannot be done in our usually not done in lab test for our academic purpose. The Heller's nitric acid test. The procedure is to add carefully about 3 ml of urine by wall of the test tube containing 3 ml of concentrated nitric acid. And the principle is nitric acid also causes the precipitation of proteins. And what you will observe, observe a white ring appears at the junction of the liquids, and interference is the protein is present. Methods of denaturation of protein by disruption of the shell of hydration. What is shell of hydration? The shell of hydration is the liquid, the watery boundary outside the molecule. Like we have read in our 11 or 12, like the grape, the salt absorb the grape, the watery content. The same fluid is this. So when we add this, the disruption of the hydration cell may be disrupted by after adding this the protein alcohol or acetone or maybe salt. Here we are using the ammonium sulfate salt. So the fourth one is the precipitation of protein in alcohol or acetone. So to a 3 ml of urine in a test tube, add 4 drops of alcohol or acetone and shake it vigorously. Then white precipitation appears if protein is present in urine. And the fifth is salting out. For it, most preferred salt is ammonium sulfate. When excess of ammonium sulfate is dissolved in urine in an attempt to solubilize itself, it drags the shell of hydration from the proteins and hence proteins are precipitated. So this too is only for your knowledge. This is not even asked in Viva also. And this is albumin and globulin ratio. Albumin and globulin ratio is the normal serum level of albumin in healthy adult is 3.5 to 5.5 gram per deciliter, and that of globulin is 2 to 3.5 gram per deciliter. The normal albumin globulin ratio is 1.5 to 2.5. And reversal of albumin globulin ratio denotes either the low level of albumin or high level of globulin. The low level of albumin in plasma may be because of reduced intake of protein in diet, like protein energy malnutrition. If you are taking less amount of protein in your diet, or the reduced synthesis of albumin in the liver due to the liver cirrhosis, or increased loss of albumin in the urine in nephrotic syndrome. High level of globulin may be because of overproduction of globulin as seen in case of multiple myeloma. So this is a clinical case. If a 5-year-old female child is brought by mother with history of swelling all over the body for the last 1 week. The swelling started on the face, especially around the eyes on getting up in the morning, and slowly it was noticed involving the abdomen, upper and lower limb. There is no history of fever, rash or sore throat. On examination, the edema was spitting type. Blood and urine investigation shows the following result. The total protein is 5.6 gram per deciliter and the serum albumin is 2.3 gram per deciliter. In previous slide, what was the normal range? 3.5, 5.5. Then it is less. And the serum globulin 3.3. What was the normal range?
2 to 3.5.
And total cholesterol is 258 milligram per deciliter, and the 24-hour urinary protein is 3.5 gram per deciliter. So here albumin and globulin ratio is already reversed. This is the case of nephrotic syndrome. So nephrotic syndrome, the criteria for the nephrotic syndrome is there is like hypoalbuminemia and the hypercholesterolemia. The cholesterol is increased here. And the 24-hour urinary protein is 2.5 gram per deciliter, which is significant for the nephrotic syndrome. There are similar case, there is like nephritic syndrome. So in nephritic syndrome, the 24-hour urinary protein is 1 to 2 gram per deciliter. The urinary excretion of the protein is less in nephritic syndrome. And also the pathology also different in nephritic and nephrotic also. In nephrotic, there is glomeruli not able to filter the albumin properly, and in nephritic, the glomeruli not able to filter the red blood cells properly. So in nephrotic, you can see the edema and the hypoalbuminemia, and in nephritic, you can see blood in the urine. The symptom is different. So in nephritic, you will see the cola color urine. By seeing the urine, you can diagnose this like edema, swelling, everything. Then you can record the 24-hour urinary and the color of the urine. Urine is cola color urine. Then clinically, you can directly diagnose that this is nephritic syndrome. And this is the clinical case too. So yes, 65-year-old male presented to orthopedic OPD with complaint of generalized bone pain for past 2 years. He is otherwise well with no significant past medical history. Following are the results of various laboratory investigations. Hemoglobin 9.7 gram per deciliter, urea 47 milligram per deciliter, creatinine 1.1 milligram per deciliter. Serum calcium level is 10.2 milligram per deciliter, and the serum ALP is 140 international unit per liter. Peripheral smear shows normocytic normochromic anemia, and the serum ferritin is normal, vitamin B12 and folic acid is normal. Serum protein electrophoresis is performed that demonstrated M band in gamma region. Skull X-ray reveals multiple lytic lesions. Urine investigation shows presence of Bence-Jones protein. Bone marrow biopsy shows 30% involvement by abnormal appearing plasma cells. Then only for your basic level, only important is this Bence-Jones protein. This Bence-Jones protein is important for your clinically involved in biochemistry, involved in clinical. So the test for Bence-Jones protein, the flocculation test. The principle is Bence-Jones proteins are light chains of immunoglobulins which precipitate at low temperature. Heat about 5 ml of acidic urine. If alkaline, acidify with 2% acetic acid in a test tube very gently and note down the temperature frequently. In presence of Bence-Jones proteins, turbidity appears at 40 to 60 degrees Celsius, and on boiling, the precipitate disappears if coagulable protein are also not present. If coagulable presents are also present, then filter the upper white part of the solution and let the solution cool down, because Bence-Jones protein precipitate in cool temperature, and after cooling down the Bence-Jones protein precipitate. And another is the Osgood-Huskin test. Add 1 ml of 5% acetic acid and 3 ml of saturated solution of NaCl to urine in a test tube. In presence of Bence-Jones protein, a white precipitate is formed which on boiling disappears. So here I mentioned if the sample is not acidic, if it is alkalic. Can you say at what condition the urine can be acidic, or at what condition it is alkalic? Anyone?
The consumption of alcohol makes us acidic.
This is not a daily lifestyle or not daily related. No one is taking alcohol daily basis. Okay. So the acidic urine, in case of we take too much of protein diet, like protein diet or heavy exercise. We do heavy exercise, and the alkali urine can be in if you take the profound amount of the vegetable in your diet, then the urine will be alkaline. I think